Have you ever gone for a routine health checkup, thinking you're safeguarding your future, only to wonder if those tests might be doing more harm than good? If you're over 70 or care about someone who is, this video is a must-watch. We're diving into the shocking truth about 5 common health checkups that could push you toward unnecessary surgeries, complications, or even cancer, backed by hard science that your doctor might not tell you about. From bone density scans to full-body CTs, you'll uncover why these tests can sometimes hurt more than they help and learn safer, smarter ways to protect your health. Stay with us until the end to discover the #1 test that's causing 5% of all cancer cases in the US. Information that could change how you approach your next checkup and save you from a world of regret. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment #1. If you don't like it, comment #0 to let me know, so I can make a better video for you. Now let's get started. Without further delay, let's dive into the first medical test on our list, exploring why it may appear innocuous at first glance but has the potential to subtly undermine your quality of life if not approached with caution. Coming in at number 5 is the bone density scan, formerly known as dual-energy X-ray absorptiometry, DEXA. On the surface, this test seems straightforward and benign. A quick, painless procedure that requires no needles, no incisions, and delivers results in minutes. You lie on a table, a scanner glides over your body, and you walk away with a report indicating whether your bones are at risk for fractures. It's often marketed as a proactive step to safeguard your health, particularly for older adults concerned about osteoporosis. But beneath this seemingly harmless facade lies a more complex reality, especially for individuals over the age of 70. The DEXA scan can sometimes do more harm than good, stirring unnecessary fear and leading to treatments that may not be warranted, potentially compromising both physical and emotional well-being. The DEXA scan measures bone mineral density, providing a numerical score, known as a T-score, that compares your bone strength to that of a healthy young adult. Its primary purpose is to diagnose osteoporosis, a condition characterized by weakened bones that are more prone to fractures, or osteopenia, a milder form of bone density loss. For younger postmenopausal women or individuals with specific risk factors like a history of fractures or long-term steroid use, this test can be valuable. However, for older adults, particularly those over 70, the results can be misleading and trigger a cascade of unintended consequences. Bone loss, much like graying hair or the appearance of wrinkles, is a natural part of aging. As we age, our bones gradually lose density, and DEXA scans in this age group almost invariably show reduced bone density, even in individuals who are otherwise healthy and active. This is not necessarily an indication of imminent danger, yet the results are often interpreted as a call to action, pushing patients toward interventions that may carry significant risks. Consider the case of Rose, a 76-year-old retired piano teacher who led an active lifestyle, walking daily and maintaining a robust social calendar. During a routine annual checkup, her primary care physician recommended a DEXA scan as a precautionary measure. The results revealed osteopenia, a condition indicating mildly reduced bone density but not severe enough to qualify as osteoporosis. Despite having no history of falls, fractures, or bone-related pain, Rose's doctor prescribed alendronate, a bisphosphonate medication commonly used to strengthen bones. These medications are often presented as a safeguard against fractures, but they come with a host of potential side effects, some of which are far from trivial. Within 3 months, Rose began experiencing severe acid reflux and persistent jaw pain, a known but rare complication called osteonecrosis of the jaw, where the jawbone begins to deteriorate. The discomfort was so debilitating that she stopped playing the piano, an activity that had been central to her identity and joy for decades. Alarmed by her symptoms, Rose sought a second opinion. After a thorough evaluation, her new care team discontinued the bisphosphonate and instead focused on lifestyle interventions. They introduced a regimen of weight-bearing exercises, such as resistance band workouts, to improve muscle strength and balance. They also optimized her nutrition, emphasizing calcium-rich foods like sardines, leafy greens, and fortified dairy, alongside vitamin D supplementation to enhance calcium absorption. A year later, Rose was not only free of fractures but also stronger, with improved balance and a renewed ability to perform piano recitals. Her case underscores a critical point. For older adults without a history of falls or fractures, lifestyle modifications often outperform medication in maintaining bone health and preventing injury. The risks of over-relying on DEXA scan results are further illuminated by research. A 2022 study published in Osteoporosis International demonstrated that lifestyle interventions, such as strength training, balance exercises, and addressing vitamin D deficiency, can reduce fracture risk by more than 20% in older adults. In contrast, a study in the Journal of the American Geriatric Society tracked over 1,200 women aged 70 and older who were prescribed bisphosphonates for mild bone loss. After 5 years, the medication reduced fracture risk by a mere 0.3%, a statistically significant but clinically modest benefit. Meanwhile, the women faced a higher likelihood of side effects, including gastrointestinal distress, esophageal inflammation, and, in rare cases, atypical fractures where bones become so brittle they break in unusual patterns. These findings highlight a critical disconnect. A test that seems harmless can lead to treatments that offer minimal benefits while exposing patients to tangible risks. For older adults who are not experiencing frequent falls or fractures, the focus should shift away from routine DEXA scans and toward proactive, evidence-based strategies. Regular weight-bearing exercise, such as walking or light resistance training, strengthens both bones and muscles, improving stability. A diet rich in calcium and vitamin D supports bone health without the need for pharmaceuticals. And addressing environmental factors, like removing tripping hazards at home or ensuring proper footwear, can significantly reduce fracture risk. A DEXA scan may seem like a prudent step, but its results can instill unwarranted fear, leading to treatments that may do more harm than good. Don't let a single number on a screen dictate your health decisions when lifestyle changes can offer safer, more effective results. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Now, let's turn to an even more concerning test, one that can escalate to something as serious as brain surgery. At number 4 is the brain MRI for memory loss, a procedure often ordered when older adults report feeling forgetful or mildly confused. It's understandable why this test is so commonly requested. Memory lapses can spark fear of serious conditions like Alzheimer's disease or other forms of dementia. Patients and their families, desperate for answers, often push for an MRI, and doctors, aiming to provide reassurance or identify a treatable cause, comply. But the reality is far less straightforward. Brain MRIs, which produce detailed images of the brain structure, frequently reveal findings that are normal for aging but can be misinterpreted as alarming, setting off a chain reaction of anxiety, additional testing, and even invasive procedures that may not improve cognitive function and could worsen quality of life. In individuals over 70, brain MRIs commonly show age-related changes, such as slight brain shrinkage, atrophy, or small white matter hyperintensities, bright spots on the scan that indicate minor changes in blood vessels or tissue. These findings are as common in healthy older adults as wrinkles are on the skin, yet they are often presented in a way that causes alarm. A 2021 study published in Neurology Today analyzed over 3,000 MRI scans in patients aged 70 to 85 with mild cognitive complaints, such as forgetting names or misplacing items. An overwhelming 86% of these scans revealed some form of abnormality, but only 3% of those findings pointed to a treatable condition, such as a tumor or hydrocephalus, excess fluid in the brain. This means that 97% of patients were left grappling with the emotional weight of being told something was wrong with their brain, even though the findings were typically benign and unrelated to their symptoms. The consequences of these ambiguous results can be profound. Nearly 12% of the patients in the study were referred for invasive follow-up procedures, such as spinal taps to analyze cerebrospinal fluid or, in rare cases, exploratory brain biopsies. These interventions carry risks, including infection, bleeding, and, in the case of biopsies, neurological damage, all without necessarily providing clarity or improving cognitive outcomes. Consider the case of George, a 74-year-old retired engineer who sought medical advice after noticing he was misplacing his keys more often and struggling to recall names. While he remained sharp in conversation and managed his daily activities independently, his doctor ordered a brain MRI as a precaution. The scan revealed white matter changes, which the radiologist flagged as abnormal. George, a methodical and analytical person by nature, was devastated, convinced he was in the early stages of dementia. The fear consumed him. He stopped driving, withdrew from his church community, and became increasingly anxious, which only exacerbated his perceived memory issues. When George sought a second opinion, a comprehensive evaluation using a standardized cognitive screening test, like the Mini Mental State Examination, MMSE, or the Montreal Cognitive Assessment, MoCA, revealed that his cognitive function was well within the normal range for his age. His care team explained that the white matter changes seen on his MRI were typical for a 74-year-old and not indicative of dementia. Instead of pursuing further invasive tests, they focused on lifestyle interventions, ensuring adequate sleep, improving hydration, reducing stress, and incorporating cognitive exercises like puzzles and brain games. Within 3 months, George reported feeling more confident, his memory stabilized, and he resumed his regular activities, including driving and attending church. The lesson here is clear. For older adults with mild memory complaints, a brain MRI is rarely the best first step. Unless there are red flags like seizures, sudden personality changes, or rapid functional decline, the scan is unlikely to provide actionable insights. Instead, a cognitive screening test, a simple, non-invasive, paper-based assessment that evaluates memory, attention, and problem-solving, offers a more reliable and less distressing starting point. These tests, which take about 10 to 15 minutes, are highly effective at distinguishing normal age-related forgetfulness from more serious conditions like dementia. They're also far less likely to trigger the emotional and physical toll of unnecessary follow-up procedures. As we move forward, prepare yourself for the next test on our list, which ranks at number 3 for a reason. It's a procedure you've likely encountered multiple times, and its widespread use makes its potential pitfalls all the more concerning. Stay tuned as we unpack why this common test may not always be as benign as it seems. Number 3. The Cardiac Stress Test, a double-edged sword for seniors. The cardiac stress test is one of the most frequently ordered diagnostic procedures for older adults, particularly those over 70, who report symptoms such as mild fatigue, occasional chest tightness, or a general sense of not feeling like themselves. This test, which involves monitoring the heart's activity while a patient walks on a treadmill or receives medication to simulate the cardiovascular effects of exercise, is designed to detect blockages in the coronary arteries that could indicate heart disease. However, for seniors, especially those without clear symptoms of cardiovascular issues, this test can often cause more harm than good, leading to a cascade of unnecessary interventions, emotional distress, and significant health risks. The primary issue with cardiac stress tests in older adults lies in their lack of precision. Research, including a comprehensive 2017 study published in JAMA Cardiology, reveals that the false positive rate for stress tests in individuals over 70 can be as high as 40%. A false positive occurs when the test indicates a problem, such as a blocked artery, when no significant issue exists. These misleading results often trigger a chain reaction of additional, invasive procedures, such as coronary angiograms, where a catheter is inserted into the heart's arteries to visualize blockages, or even stent placements and bypass surgeries. The JAMA Cardiology study found that over 50% of stents placed following stress test referrals were performed on patients who exhibited no clear symptoms of heart disease and derived no measurable benefit in terms of survival or quality of life. The risks associated with these follow-up procedures are far from trivial. Seniors undergoing angiograms or stent placements face heightened risks of complications, including bleeding at the catheter insertion site, kidney damage from the contrast dyes used during imaging, and even heart rhythm disturbances. Prolonged hospital stays and the need for extended recovery periods further compound the physical and emotional toll. For example, consider the case of Raymond, a 75-year-old retired postal worker who maintained an active lifestyle, walking several miles daily. During a routine checkup, Raymond casually mentioned feeling slightly fatigued when climbing hills. Out of an abundance of caution, his physician ordered a cardiac stress test. The results were ambiguous, prompting a coronary angiogram. The procedure revealed a mild narrowing in one of Raymond's arteries, and a stent was placed to address it. Unfortunately, the intervention did more harm than good. That evening, Raymond developed an adverse reaction to the contrast dye used during the angiogram, leading to acute kidney injury. He spent 6 days in the hospital, required weeks of follow-up care, and faced ongoing challenges with his kidney function. The irony? His fatigue was not caused by a heart condition but by simple, age-related factors such as mild dehydration and inadequate rest between meals. Had his physician opted for less invasive evaluations, such as a resting electrocardiogram, EKG, or a discussion about lifestyle adjustments, Raymond could have avoided this ordeal entirely. For seniors without classic symptoms of heart disease, such as chest pain during physical activity, significant shortness of breath with exertion, or a marked decline in energy during light exercise, cardiac stress tests are often unnecessary and potentially harmful. Safer alternatives exist. A resting EKG, which records the heart's electrical activity while the patient is at rest, is non-invasive and carries minimal risk. Another option is a coronary artery calcium (CAC) scan, a low-radiation imaging test that quantifies the presence of calcified plaque in the coronary arteries. This scan provides valuable information about cardiovascular risk without exposing patients to the hazards of invasive procedures. By prioritizing these safer diagnostics and reserving stress tests for those with clear indications, physicians can protect older adults from the pitfalls of overtesting. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 2. Colonoscopy, a risky routine for older adults. The colonoscopy, a procedure that uses a flexible, camera-equipped tube to examine the colon for abnormalities such as polyps or cancer, is often hailed as a cornerstone of preventive care. However, for individuals over 70, and especially those over 75, routine colonoscopies may pose significant risks that outweigh their benefits, particularly in the absence of specific symptoms like rectal bleeding, changes in bowel habits, or a strong family history of colon cancer. The U.S. Preventive Services Task Force, USPSTF, recommends against routine colon cancer screening for most people over 75, yet many seniors are still encouraged to undergo this procedure, often to their detriment. The risks of colonoscopy increase with age due to several factors. First, the preparation process, which involves consuming powerful laxatives to clear the colon, can be grueling for older adults. This regimen can lead to dehydration, electrolyte imbalances, dizziness, and even kidney damage, particularly in those with pre-existing health conditions. Second, the sedation required during the procedure carries additional risks for seniors, including potential impacts on cognitive function and an increased likelihood of adverse reactions. Finally, the procedure itself is not without complications. A 2019 study published in JAMA Internal Medicine, which analyzed data from over 1.3 million Medicare patients aged 70 and older, found that for every 1,000 colonoscopies performed in those over 75, only 2 lives were saved from colon cancer. In contrast, more than 20 patients experienced serious complications, such as bleeding, bowel perforation, or heart rhythm disturbances caused by sedation. This stark 10-to-1 risk-to-benefit ratio underscores the need for caution. Even when colonoscopies detect polyps, the findings may not justify intervention. Many polyps found in older adults are small, slow-growing, and unlikely to become cancerous within the patient's lifetime. Removing these polyps can introduce unnecessary risks, including bleeding or perforation of the colon wall. Consider the case of Dana, a 73-year-old grandmother who ran a small bakery with her daughter. Dana was in excellent health, with no symptoms of colon issues, no family history of colon cancer, and 2 prior colonoscopies that showed no abnormalities. Despite this, her new primary care physician, eager to follow screening guidelines, recommended a routine colonoscopy. Reluctantly, Dana agreed. During the procedure, a small polyp was removed, and Dana was discharged. That night, she experienced severe abdominal pain and fainted. She was rushed to the hospital, where doctors diagnosed a bowel perforation, a rare but serious complication of colonoscopy. Dana spent 9 days in recovery, lost 10 pounds, and struggled to regain her strength. Her quality of life has not fully recovered, and a review of her medical history revealed that the colonoscopy was unnecessary given her clean prior screenings and lack of symptoms. For seniors, safer alternatives to colonoscopy exist. The fecal immunochemical test, FIT, a non-invasive, at-home stool test, can effectively detect blood in the stool, a potential indicator of colon cancer, without the need for sedation, harsh preparation, or invasive procedures. The FIT test is recommended by the USPSTF as a viable screening option for those in good health who prefer to continue monitoring after age 75. Additionally, shared decision-making between patients and physicians is critical. Seniors should discuss their personal risk factors, overall health, and preferences with their doctor to determine whether screening is necessary and, if so, which method is safest. Once a patient enters the colonoscopy pipeline, it can be difficult to avoid the momentum toward further tests or interventions, making it all the more important to choose wisely from the start. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 1. Annual full-body CT scans. A dangerous overreach. Topping the list of overused and potentially harmful checkups for seniors is the annual full-body CT scan, often marketed as a cutting-edge tool for early disease detection. These scans, frequently included in executive health packages or offered by private clinics as part of preventive care, promise to catch cancers and other conditions before symptoms arise. However, for older adults, particularly those over 70, the risks of these scans far outweigh any proven benefits, and their routine use in asymptomatic individuals is strongly discouraged by medical experts. The most significant concern with full-body CT scans is their high radiation exposure. Each scan delivers between 10 and 20 millisieverts of ionizing radiation, equivalent to approximately 500 chest X-rays. A 2023 modeling study published in JAMA Internal Medicine estimated that the widespread use of CT scans in the United States may contribute to up to 5% of all cancers, placing them on par with alcohol as a cancer risk factor. This means that 1 out of every 20 cancers diagnosed could, in theory, be linked to radiation from diagnostic imaging intended to prevent disease, a deeply troubling irony. Beyond the radiation risk, full-body CT scans are notorious for detecting incidental findings, small nodules, calcifications, or cysts that are often benign and part of the natural aging process. These incidentalomas can trigger a cascade of follow-up tests, including additional scans, biopsies, and even surgeries, all of which carry their risks. The emotional toll of this process, often referred to as the diagnostic odyssey, can be immense, as patients grapple with anxiety and uncertainty over findings that may never have caused harm if left undetected. Consider the case of Marcus, an active 80-year-old former martial arts instructor who felt healthy and vibrant. As part of a senior elite health package at a private clinic, Marcus underwent a full-body CT scan. The scan revealed a tiny 3 mm lung nodule, prompting a referral to an oncologist. A PET scan and a needle biopsy followed, but the biopsy caused a partial lung collapse, requiring hospitalization and a 2-month recovery period. The nodule was ultimately benign, meaning Marcus endured significant physical and emotional hardship for a finding that required no intervention. The American College of Radiology and other leading medical organizations are unequivocal in their stance. Full-body CT scans should never be used for routine screening in asymptomatic adults. There is no evidence that these scans improve survival or quality of life in the absence of specific symptoms, such as unexplained weight loss, persistent pain, or coughing up blood. When imaging is warranted, targeted scans, focused on a specific organ or area of concern, are far safer and more effective. A smarter approach to preventive care for seniors is to prioritize regular checkups with a trusted primary care physician, listen to the body signals, and pursue diagnostic tests only when clear indications exist. Blood tests, physical exams, and targeted screenings based on personal risk factors are often sufficient to monitor health without exposing patients to unnecessary risks. By avoiding fear-driven blanket screening approaches like full-body CT scans, seniors can preserve their time, energy, and well-being, focusing instead on maintaining a healthy lifestyle and addressing symptoms as they arise. That's it for today's video, revealing the 5 health checkups you should think twice about after 70 and the surprising risks they carry. We hope this has opened your eyes to the importance of questioning routine tests and focusing on lifestyle for true prevention. What have you learned from this video? What's one thing you'll take away and put into practice in your life? Maybe it's asking your doctor more questions, prioritizing strength training, or skipping an unnecessary scan. Drop it in the comments below. We're reading every single one and can't wait to hear your thoughts. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more eye-opening health insights like this. Stay healthy, stay informed, and we'll see you in the next one.